These intraoral cameras can be used chairside to convince the patient about what they have, what all lesions we see inside the oral cavity. Then images are transmitted to the computer and can be seen both by the patient and dentist. Next we come to CAD/CAM. CAD/CAM is also common, very common these days. It's computer-aided design and computer-aided manufacturing are digital technologies that are used to design, plan and ultimately create dental prosthetics with 3D printing technology. So it has created the manufacturing of the processes very fast. Can take as little as 45 minutes. So we have a video of CAD/CAM. We have digital smile designing or DSD. It's a digital mode that helps us to create and project the new smile design by attaining a simulation and pre-visualization of the ultimate result of the proposed treatment. We can digitally we can create the smile of the patient. We can understand what the future result of the treatment will be. It involves the participation of the patient on the designing process of their smile. So the equipment that include a computer with one of the DSD software, a digital SLR camera, a digital intraoral scanner, a 3D printer and CAD/CAM are additional tools for complete digital 3D workflow. So the softwares that are available are Smile Designer Pro, Aesthetic Digital Smile Design and ExoCAD 3D software. So what we do is take a series of images, then we do the analysis. And diagram A, we do the intraoral analysis. There's the dental analysis. Then we do the intraoral analysis. Then we, in the diagram C, we create the smile of the patient. We compare both this, and in the diagram E, we can see the difference between the digitally created smile and the original smile of the patient. So these are all the present scenarios. Now we come to future. What all we can have in future. First one, we have the virtual simulators for dental training. We all know that during our second year we do preclinical conservative. We use the typho teeth to create cavity. So actually it doesn't give a correct, it's not a correct method. That is, we don't have any differentiation between enamel, pulp, dentin like that. We simply cut cavity in the resin tooth model. So the scientists, they have led to the invention of virtual simulators. That we can see this. The importance of training led to the introduction of simulators which work via virtual reality, that provides 3D virtual environment with real-time interaction, thereby allowing an accurate reproduction of tasks. Voxelman Dental is a newly developed dental simulator. The thing is that the teeth and the instruments are modeled in computer and visualized in a 3D screen. Thus we have the teeth and the instrument in the screen, in the 3D screen. Then the dental handpiece, that's the micromotor or aorta, whatever maybe, that we use is represented by a haptic device. So this represents that too. Then this is the haptic device. So this it represents the dental handpiece. We can have both the instruments and everything in the screen. Then the importance is that we can feel the subtle difference between enamel, dentin, pulp or caries tissue based on the virtual reality. So if we select a tooth, that's 4/6. If we want to prepare a cavity in 4/6, we select 4/6. Then we have all these instructions as the task preparation. What all we have to do? If you have to do a preparation for gold, then skip like that. Then with the help of that device, haptic device, we cut cavity like this virtually, and we can even feel all the sensations like the human teeth. And so we have virtual dental simulators. Then we have virtual dental patient. Creates a craniofacial virtual model by image fusion of intraoral scanner, CBCT, and extraoral scanner under 3D conditions. So what we do is, imagine a patient coming to us and he requires some treatment, maybe some aesthetic corrections or something. So we create that patient. So we do all this scanning. There's intraoral scanning, CBCT, and extraoral scanning. Then by using a software, we create that patient in our on our screen, and then we analyze the treatment of the patient. So we have a scenario that's now we are showing. It's a technique described on a 25-year-old man who attended the Digital Stomatology Center of Tongji University seeking an aesthetic restoration of a fractured maxillary incisor. So this is the patient. We can see that he has a fractured maxillary incisor. The problem was that the patient had an increased vertical overlap that is subsequent to abnormal passive tooth eruption. So due to passive tooth eruption, he had an increased vertical overlap. You see, he had an increased vertical overlap. So it will be difficult to do composite restoration. So the maxillary left lateral incisor had a large discolored composite resin restoration, and the patient declined orthodontic treatment and accepted crown lengthening surgery and complete crown restoration. After endodontic treatment, the treatment included the creation of a virtual dental patient. So we see what are the following procedures. First, we scan the maxillary and mandibular arches and the intercuspal position by using an intraoral scanner. Then we do the extraoral scanning, and then we do CT scan in the intercuspal position. So we have done all the scanning, and now we use a device called the jaw motion analyzer. So this instrument helps us to identify the mandibular movements. So what are movements? The movements that are that take place when the patient moves the mandible. So we record the jaw movements. Then we import the data of intraoral scan. Then we import all these data into a dental software program. So based on teeth, fixed points on the forehead and other tissue markers matched by the face of fork, we merge all these data to create a virtual dental patient. So this is the virtual dental patient. We can see that by merging all those data that we had from intraoral scanning, extraoral scanning, and CT we get, and we also got the mandibular movement. It's a still photograph. Now we determine the position, and we know that the patient had to undergo a crown lengthening surgery. So we determine the position and shape of the gingival margin and the definitive restoration in the digital dental software program based on the virtual dental patient. With that, we create a surgical template and the 3D and aesthetic analysis cast as we do. We create a restoration first by virtually, then we print a 3D analytic cast in the second diagram. And with the help of that surgical template, we do the crown lengthening surgery, as we can see in the third diagram. Then after that, after 6 months, when the gingival contours have stabilized, we remove the interim restoration and then prepare the teeth. We rescan both the dental arches, and then we virtually we design the restoration, and then it is printed by it's milled using CAD/CAM, and then we the restoration. So this we have in case of the virtual dental patient. Next we have Dscan. So Dscan is a tool that a dentist can use to accurately measure the force and timing of your bite or occlusion. That's, to know the bite or occlusion of the patient, we can have this machine known as Tscan. It allows dentists to see the unseen, as the relative force and timing, or in other words, gain a precise understanding of what exactly is going on in your mouth when your teeth come together. So how does it work? We have a Tscan handpiece. This is a Tscan handpiece with a sensor that fits inside the size of the size of your mouth. Then your dentist will insert the sensor into your mouth and ask you to bite down a few times while recording the force and timing of your teeth coming together. So based on the software reading, your dentist will be able to see which teeth are hitting the hardest, and if you have any occlusal imbalances that may negatively affect your overall health in the short or long term. We know that incorrect occlusal forces can lead to MPDS like conditions, so this can help in properly diagnosing which tooth is causing the occlusal imbalance. Now we have virtual microscopy. Virtual microscopy or whole slide imaging is an advanced form of technology. That's conventionally we take a slide and then we view it through the microscope. So it take a long time in diagnosis. So now we have virtual microscopy, in that we scan the whole slide. We scan it and then we upload it into a software, and then from different places, different pathologists can view the slide and help in diagnosis. So the viewer of the digitized slide can access the entire histological section and can pan, zoom and focus to view individual cell organelle, and hence can make an accurate diagnosis. So the process, as I said earlier, it's a whole slide scanning. Then we store the digitized slide in a high capacity server. Then we edit the digital slide for color, brightness and resolution, display of digitized slide. Then making the diagnosis with the help of inbuilt diagnostic software, which can be used for zooming and focusing individual cells. Next we have virtual articulators. So we all know what our articulators are. Virtually, with the help of computer software, we can create an articulator. We can select what type of articulator we need, and it helps in reproducing the relationship between the jaws and simulating jaw movements. Basically, there are two types of virtual articulators, that are completely adjustable virtual articulators and mathematically simulated virtual articulators. So earlier we said about jaw motion analyzer. So it helps in the recording relations in completely adjustable virtual articulators, and mathematically simulated articulators are based on the average values. Next we have big data analytics. We know that all these health data are big data. We cannot directly transfer it. So it refers to the methods, tools and applications used to collect, process and derive insights from varied high volume, high velocity data sets. So imagine a condition. So we are talking about the future scenarios. Imagine a condition that we are having a tooth pain early in the morning, and we take our smartphone and we scan the area, and then the data is directly uploaded into the software, and the dentist calls us and tells us about the treatment. So the electronic health record is a rich source of data that helps dentists understand their patient inside out. By analyzing big data, dentists can help patient improve health diagnose the disease at an early stage, and also provide their patient with personalized dental care. So we come to advantages and disadvantages. What are the advantages of digitalization in dentistry? We have more efficient workflow. That's the digital dentistry has increased the efficiency for several manufacturing process and dental service workflow. Then faster manufacturing time. With the emergence of digital dentistry, design models can be done digitally and printed instantly. Then enhanced experience and client satisfaction. Then dental treatment expansion and future investment. So what are the disadvantages? We have high investment cost for hardware, high investment cost for training, then implementation will take time, then concerns about protecting individual health information, rights and privacy. So we come to conclusion. That's digitalization can pose a lot of challenges over the current dental practice. It is crucial to closely monitor both the potential and challenges posed by digitalization in dentistry. Ultimately, it is only those problems that are identified as such that can be resolved, and only those technologies that are accepted by dentists, patients and the society that will prevail in long term.